Hello, everybody, and welcome. Welcome, everyone. This is a panel discussion brought to you on behalf of the Positive Justice Advisory Group and the Center for HIV Law and Policy. It's a panel discussion on the role of U equals U in criminal law reform. It's called Criminalization and U equals U, viral suppression and criminal law reform. So thank you, everybody, for joining. First of all, my name is Amir Sadeghi. I'm the National Policy and Partner Strategist with the Center for HIV Law and Policy, which is a national legal resource and strategy center for people living with HIV and their advocates working to challenge legal barriers that discriminate against people living with HIV. And the Center for HIV Law and Policy co-founded the Positive Justice Project, which was the first national coalition and collaborative formed to end the criminalization of HIV and the criminalization of other stigmatized diseases and identities. And PJP, the Positive Justice Project, has an advisory group, which is an advisory body of people with direct lived experience, people living with HIV, current and former sex workers, and other folks working together to guide a national strategy to end the criminalization of people living with HIV and other stigmatized diseases. And they are currently embarking on a webinar series on some kind of cross-cutting, intersectional, deeper dive issues that affect them and their work, their anti-criminalization work. Our first webinar in this series was a guide to state-level organizing to reform HIV criminal laws, and you are watching the second in this series, which is on the role of treatment as prevention in HIV criminal law reform. And please stay tuned to the Positive Justice Project, because the next webinar in this series will be on civil commitment and sex offender registries in HIV. So please stay tuned for that. But before we move on, I'd like to just invite our panelists to introduce themselves and share a little bit about their work, and if they're here on behalf of an organization, and what brings them to this work of specifically modernizing and reforming HIV criminal law. So Deondre, would you mind starting us off?
Sure. Thank you for having me. Thank you for everybody who's here that I get to sit on this panel with. I'm extremely excited to be here. To those who are watching and listening, my name is Deandre Moore. I am the United States Partnerships and Community Engagement Manager for Prevention Access Campaign, which is the founding organization for U equals U, also known as undetectable equals untransmittable. I've been involved in the field of public health, specifically HIV, for about 6 to 7 years since my diagnosis at the age of 19. I'm 26 now, and I'm excited to be here. Criminalization as it relates to HIV has been a touchy subject for me. Over time, my ideologies and my thoughts around criminalization has shifted dramatically, and I'm able to say that just being in this space and from listening to folks who have been criminalized and just knowing that we're working towards something that is not only going to reduce stigma in this country and in our communities, but it's also going to help save lives of many folks. So thank you. I think is Dev next.
Yes.
Hey, thank you for that. Hey, everybody. My name is Devin Hersey, he, him, his. I am an advocate living in Columbia, Missouri, which is right in middle Missouri. And I am also a member of the Missouri HIV Justice Coalition. And we're really the state level coalition that's really moving to modernize Missouri's harmful HIV criminalization statute. The statute in Missouri doesn't really consider things like intent, and also has penalties when no HIV transmission even takes place.
Thank you, Devin. Linda, would you like to introduce yourself?
Yes. Hello, everyone. My name is Linda Dixon. My pronouns are she, her, and hers. I'm the Health Law Director at the Mississippi Center for Justice in Jackson, Mississippi. And I just want to thank Amir and the Center for HIV Law and Policy and the Positive Justice Project Advisory Group for the invitation to join my colleagues for this robust discussion. So I'm really excited about doing that. The first time this issue was brought to my attention my response was, I don't do criminal work. I'm not a criminal attorney. And as I delved deeper and opened my heart and my mind, I quickly realized that this was not only a criminalization issue, but a racial and social justice issue. Hence, breaking out of our silos of how we normally conduct and do business and merging different areas of work into the HIV arena to leverage our resources to better serve people living with HIV. So I've been working on this issue for some years. I've been doing HIV work for about 12 years, and it's become a mission and a passion. Thank you.
Last but not least, Eric.
All right, so I'll round it out. So Eric Paulk here, he, him, his pronouns, Deputy Director at Georgia Equality. Georgia Equality is a statewide policy and advocacy organization focused on LGBTQ communities and communities of people living with and vulnerable to HIV acquisition. This work is really important to me. I mean, I think similar to Linda, you know, I'm interested in how we frame HIV criminalization, not from this sort of narrow framing around behavior and risk, and really broadening that conversation to talk about the structural barriers that make folks vulnerable not only to HIV, but HIV criminalization and other forms of criminalization, and really how, you know, that's impacted Black communities and other communities of color, especially across the South, and what a lot of that looks like. And so I'm interested in really having a conversation and unpacking a lot of this with my colleagues. So ready for a robust conversation with my folks here.
Thank you so much, everybody. And Eric and Linda, I think that framing and lens is going to be the most important thing as we have this conversation, because this dialogue is really about the legacy of anti-Black racism and how the anti-criminalization work that we're doing can be best strategized and reformed and informed to tackle those legacies. So, you know, many folks tuning in might be familiar with the HIV treatment as prevention in criminal law reform consensus statement, which was published back in 2017. And the origin of that document is it's a little important to the framing of this dialogue, because back then in 2017, there were some reasons to have a discussion about the role of viral suppression in criminal law reform. There was a mix of views on how best to use the miraculous advances in HIV treatment and preventative tools in anti-criminalization work. And I think, you know, I'd like to begin this conversation by saying that there is no disagreement at all on behalf of all the parties on just how remarkable the advances in HIV treatment and preventative tools are and have been. There's no disagreement, I think, especially on behalf of the folks at the Positive Justice Project and on the PJP Advisory Group, that the advances in treatment and prevention that leads to viral suppression and undetectable equals untransmittable are incredible stigma-busting and narrative shattering tools and advocacy resources. So to begin, actually, I'd like to invite Deondre to please share with us a little bit about what is the U equals U campaign and how did it transform the landscape of the HIV advocacy movement?
Yeah, thank you. First, if I don't say this first before getting out there, thank you to everybody who's been on the front lines of criminal law reform as it relates to HIV and AIDS. It was about maybe like 4 or 5 years ago, my first time going to HIV is Not a Crime. It was in Huntsville, Alabama, and just to see so many folks that are pushing really hard. I learned so much during that time because I went in with a closed mindset that some folks should be criminalized. You know, that was my mindset then. And then leaving that conference and seeing all of these amazing folks, specifically the women who were leading those discussions and these conferences, talk about this really did change, you know, my thought process around criminalization as it relates to HIV. So again, thank you to all of you who have been on the front lines of this work. We're talking about U equals U. So for those who don't know, the Undetectable Equals Untransmittable campaign came about after we launched a consensus statement back in early 2016 by a group of everyday people, advocates who are living with HIV, who wanted to get this information out and disseminate it into the communities globally, to know that, make sure that people who were newly diagnosed, folks who have been living with HIV, would know that a person who has an undetectable viral load simply cannot transmit HIV sexually under any circumstances. It's been amazing. It's been an amazing journey, but there are still some folks and some policymakers who are not listening today. One of the things that we've been able to understand is that viral load does not equal value. That's true. And from my view and my colleagues' view is that we don't want to get caught up in saying that viral suppression and undetectable equals untransmittable should be the leading forefront of criminal law reform as it relates to HIV criminalization. Because then that gives policymakers, that gives other folks outside of this realm to use the argument that, well, what about a person who is not able to reach undetectable viral load? Do they become criminalized? That's not going to be okay. However, viral suppression still plays a role as we talk about policy reform coming in and allocating funds to certain areas so that folks who have not yet reached an undetectable viral load can do so. So when we think about having conversations with policymakers, we have to consider what's something that actually gets the policymakers' attention, right? 9 times out of 10, when we go into these offices, if any of you have ever went into the office to talk with a policymaker, whether at the federal, state, or local level, you know, these kind of conversations, I mean, it doesn't seem as though they're that interested. But when we start talking about money and the amount of money that can be saved when we provide the necessary resources to folks living with HIV so that they can get on treatment and stay on effective treatment, reduce stigma, and reduce the transmission of HIV, then we're talking about saving money. Then we're talking about providing more resources to folks who aren't privileged enough to have it that easy. And these are the kind of conversations that we have to continue to have. And we use the public health argument around U equals U as a leading forefront for those types of arguments. This is more than just something that's empowering, it's factual. It's something that every person who is newly diagnosed can work towards. It's not always that easy for everybody. Everyone is different. But we have to continue figuring out what's going to work for each person and ensuring that everybody knows how to actually advocate on their own behalf so that they can get there. And studies have also shown that increased viral suppression among people with HIV correlates with a reduction in new HIV diagnosis. It might sound kind of repetitive, but it's true. You know, folks who can get on treatment and stay on treatment will not transmit the virus sexually.
Deandre, I think you expressed so perfectly how, sorry, can everyone
I can hear you, yeah, I can hear you.
I think it was well put that the science behind the U equals U campaign can be kind of a gadfly in the back of a lawmaker or a policymaker. We know that that the New York City Department of Health is one of the first kind of municipal government bodies that came through with the Prevention Access campaign on undetectable equals untransmittable. So I think, Devin, I'd like to bring you in on this. You know, viral suppression, it seems like it can be a strong resource and a part of the toolbox of advocates who are working to shape their state's laws as part of this public health strategy to strengthen the advocacy around universal access to care. But at the same time, there are the realities on the ground. There are some tensions between the access to treatment in states like Missouri and what that means for the laws and how they're enforced in Missouri. For example, the Williams Institute report, which was released just last year, I believe, on HIV criminalization in Missouri, shows that between 1990 and 2019, 593 people were arrested for HIV-related felonies in Missouri. Over half of those people were convicted. Of all the people arrested for HIV-related offenses or Department of Corrections, Department of Mental Health offenses, exposing officials in a correctional setting to bodily fluids, for example, over 2/3 were arrested for a Department of Corrections crime. And key data in Missouri also showed that Black people were overrepresented in the arrest and prosecution for these HIV-related offenses. So what are the consequences for advocates working on the ground as part of a state coalition, working to modernize or reform their HIV criminal laws? What are the consequences of relying on treatment as prevention or viral suppression, given the Missouri context of the enforcement data?
Yeah, thank you. And thank you for bringing up that data. As you're going, I also want you to include the fact that the Williams Institute found that there's, for every 60 people living with HIV within the state, there's one person who's been arrested for those HIV crimes. So that goes along with the data that you're reporting. But yeah, the first thing that I want to do before I ever discuss UCO's is talk about what a benefit it is to the community, and you know, just how much work had to go into really building this campaign up from you know, being just a research study into the campaign that it is today. So that took a whole lot of work, and it's really important. It's like the backbone of prevention at this point. But in my experience and just what I've seen, there's normally like a disconnect between the intention of the campaign and what actually happens. Well, there's a disconnect between the intention of the campaign and the way that people are impacted when they're organizing on the ground, and a lot of the realities of just living with HIV. And I feel like it's important to call that out and to really frame that, because I feel like a lot of the time UCO's is very aware of what the concerns are, and have strategies to respond to, you know, to respond and intervene, but they're not always reflected in what we're seeing. So, so an example of that is, you know, UCO's is such a big campaign. Our policymakers, a lot of them already know about it. So when we're going in to educate people on our bills, that's something that we have to prepare for. We have to strategize, how are we going to get around their biases that they exist when they want to make a law about you equals you? That's not what we want to do. And I really don't think that's what the campaign intends for lawmakers to do either, but it's something that we have to navigate, just because they know those two letters and they really don't know the caveats or how you would have them go about navigating that terrain. So, and that kind of just speaks to the campaign. The campaign is, you know, focused on really promoting those two letters and not really promoting the caveats. At least they're at least just not as visible. And it, like I'm saying, it impacts the way that we have to go about with legislative advocacy. The law in the state of Missouri, I just want to touch on a couple of things. So the law, including anything, well, you know, any change to Missouri's law pretty much is going to improve it, because the law criminalizes behaviors like spitting and biting, or behaviors that really carry no risk of transmission. And also, our law is a disclosure law, so the burden of proof is just proving whether or not you disclose, which is kind of impossible. So let me see. And the other thing I want to include, because it's a disclosure law, the law doesn't really take into consideration what your intention is in the first place. And that includes things like condom use or any other sort of prevention, including U equals U. So adding that to the law might seem like it's a benefit either way, but we kind of know, given the health disparities, who's going to be left out. So kind of the general concerns go back to what's now being referred to as the viral divide. So we have people living with HIV, and then we have the subclass of people who don't have an undetectable viral load. And not everybody is going to have an undetectable viral load. We need to remember that engagement in care is a choice. And sometimes Black people will refuse to engage in care because they refuse to engage with racism. It's very real in the clinic. I used to work in the clinic. I just left my job in the clinic. And also, you know, I told you I wasn't going to discuss immigration, but we also need to think about public charge and what that means to people living with HIV. There are real reasons why people need to avoid going to care when there's policies that would threaten your citizenship status or penalize you for things like that. So not everybody's going to have is going to want to engage in care the same way, or even going to be able to achieve an undetectable viral load. The other thing that I want to discuss in terms of U equals U's utility and prevention. So there's some really interesting conversations that have been happening in Kansas City, like really trying to educate the community on U equals U. There was one event that was for women that happened in Kansas City, and they kind of shut it down. They're like very confused because it was presented to Black women as really, you need to trust your partner. And if we're considering, just how many women get an HIV positive diagnosis when they've been engaged with their primary partner, it's kind of like gaslighting, to be very real. In my opinion, U equals U as an individual prevention measure is about as effective as monogamy, because it's one of those strategies that requires you to trust your partner, basically. So I think that we should really look at how that's framed overall. And that goes back to what I was saying initially. There's a disconnect between what the intention of the campaign is and how it is likely to be interpreted. There's a lot of range when you're giving people just 2 letters to kind of take it wherever you want to take it. So in my opinion, when we're talking about the impact on the ground, it really depends on who is empowered enough to interpret the message for you. From what I've seen, U equals U oftentimes uses a top-down approach to really engaging communities, to engaging municipalities, governments. We're being educated by our government. They're telling us what U equals U and that we need to accept it, rather than the most marginalized people within the community trying to educate our decision makers. Now go ahead and end there.
Devin, thank you. And, I think a lot of the concerns that you highlight are actually what brought the original convening of organizations and individuals in 2017 together, including folks at the Prevention Access Campaign, because I think they were also uniquely aware that here's this advocacy campaign that's, focused on really enriching and strengthening individuals' access to care and connecting them to care, because, undetectable viral loads mean an untransmittable, virus.
Yeah.
So, sorry.
I was going to touch on that just to clarify that from a prevention access campaign standpoint, we don't promote the letters. One of the things that we really promote is the science, and the science is factual. And there's no debate around that. Is that we're promoting that the person who is undetectable cannot transmit that virus. And it's not it's not solely relying on your partners or whether or not you trust your partners or not. It's about trusting one's own self. And if a person who is HIV negative knows the science and they know that these things are true, it's about believing the science the same way we believe the science when we go to our doctors and they talk about cancer. We go to our doctors and we believe them when they talk about COVID-19 and these new diagnoses and that we should wear a mask. If we can believe all those things, then we should be able to believe those doctors and these experts when they say that a person with an undetectable viral load just cannot transmit that virus. And that can be used as a mechanism to empower folks at every level of policy, federal, state, local, and everything to come on in and provide more resources so that other folks who have not yet been able to get to that level of viral load suppression can have the resources to get there.
And Deondre, I think that's a really good point, because I think you're helping flesh out that there's a distinction here, right? There's a distinction between the public health strategy around universal access to care and life-saving treatment and humanizing people living with HIV. But there's also the recognition that in a criminal law reform context, which is really what brings a lot of us to this, virtual table to have this panel discussion, something that unites a lot of us as HIV anti-criminalization advocates, that there's a separate issue where there, I think, and this is really what Devin was touching on, that there's an inadvertent consequence of using as a talking point maybe with a state lawmaker that it's unjust and wrong to criminalize someone who has an undetectable viral load because they cannot sexually transmit HIV. And the unintended consequence there is that we could reinforce an idea in a lawmaker that it would be acceptable to then criminalize folks who have not achieved viral suppression. Is that, Devin, is that kind of the...
Amir, yeah, I know that some of those questions are directed at me, so I want to, you don't have to speak for me. So what I was saying is that there's a difference between the intention and what we're seeing on the ground, because Amir, you're on all of our coalition calls. This is something that we have to strategize around because we know that people already know the campaign. So a lot of our work that we're doing is to respond to that. So, some of our opposition are like doctors and pharmacists. They are familiar with this campaign, and we have to make sure that we go in and do a lot of the background education that didn't come the first time around. So, so we're having to be a bit reactionary.
Well, Eric, I think maybe this is actually a good touchstone for you to come in, because I think, the CDC is in your backyard, right? And I think Georgia is also one of the states that the Williams Institute has released a report on HIV criminalization with the enforcement data there that really reinforces and confirms what most of the other enforcement data shows, that Black men are overrepresented in arrests and convictions, that Black men are specifically more likely to be convicted, and that convictions for HIV arrests were 3 times as likely as when there was a concurrent sex work arrest, which is similar to some of the data in Florida. But as one of the Georgia state coalition leads working to reform HIV criminal law, I think Devin touching on the education piece and a proactive education piece is what I think consists of a lot of the work of a reform advocate working on the ground in a state like Georgia, right? So, Eric, that said, how do we connect this education piece and maybe reacting to certain campaigns, but also trying to be proactively engaging policymakers and prosecutors on sexual health literacy and on the roots and risks, on the real roots and risks of HIV transmission? How do we connect that piece?
Yeah, so I think that's an important part. I also think that U equals U is really an important tool when we think about our broader strategy around reforming HIV criminal law. But I do want us to, in this moment, in this conversation, really think about sort of reframing some of our conversations around HIV criminal reform. And so I think that a lot of it is really based on behaviors and not so much around really the barriers that provide the barriers to specific communities around gaining access to healthcare, issues around the criminal justice system that I think are really kind of the drivers around HIV criminalization and HIV in Black communities. And so just to kind of, think about this, as early as 1986, like the CDC knew that HIV was disproportionately impacting Black communities, right? 1993, HIV becomes the leading cause of death for Black men 25 to 44, and the second leading cause of death for Black women in that same age range. It's not until 1998 until there's the Minority AIDS Initiative, which starting to put funding dollars into Black communities. And so what you have here, one is really just a failure in policy, and really addressing early on issues around HIV in specific communities. And so you couple that with, the war on drugs, this legacy of crime and punishment that was also at its height during 1990, when a lot of these laws really came into place. And so it really kind of creates this sort of perfect storm to really provide really a pipeline into mass incarceration for Black communities, really kind of using public health as a framework around that. And so I feel like in this moment of COVID, we're really kind of seeing that kind of play itself out again. And so, the folks who are most impacted by COVID are Black communities. And those are also the communities that are going to be most surveilled. So when, there were curfews, it was Black communities who were folks who were on the front lines, who were the essential workers, who were being surveilled and criminalized for wearing a mask or not wearing a mask. And so this is really more about a legacy of anti-Blackness, and not so much, just this sort of focus around behavior that I think that we sometimes sort of frame this conversation. You mentioned the data from, the Williams Institute. And so what some of that data bears out is that, even in the application of HIV criminal laws, Black people are treated differently in the application of the law. And so, when we talk about white men and Black men who are charged with an HIV criminal charge and some other charge, white men are going to be more likely, I think twice as likely, to not be charged with the HIV-related offense, which is a felony. And so this really, helps to kind of put a framework around, what some of this is and what our strategies need to look like. And so I think the HIV criminalization movement and the HIV movement at large, has largely centered around LGBTQ communities, really communities of white gay men. And, I think that we have to start talking about HIV and HIV criminalization and criminalization reform really as a racial justice issue and as a part of the greater conversations around criminal justice reform. The same folks who are impacted by, marijuana and, low-level drug offenses are the same folks who are impacted by these laws. And so I think that we really have to have a shift in the way that we're having the conversation. The other part that I want to talk about here is, we've spent a lot of time talking about reforming the laws through legislation. And so, yes, that is a route and, a good tool for us to have in our tool belt. But I think that we also have to think about our work with prosecutors and electing prosecutors. And so, again, when we're thinking about criminal justice reform, and that over 90% of prosecutors who are elected in the country are white men, that has an impact on the charges that are being brought and really the discretion that prosecutors have around these issues. And so, I think that, yes, the science, yes, U equals U is a critical part of our toolbox, but it's not the only piece. And I, by no means, of downplaying the importance of U equals U and the U equals U campaign and what that means for folks. But I think that it's a part of what our broader strategy needs to look like, not the strategy. And so I'll kind of leave it there. I feel like I said a lot. I hope it landed and people understood some of those things. And so, yeah, I'll stop there, Amir.
Yeah, I think that's a perfect summation, right? It's a tool in the toolbox because the strategy is complex, right? I mean, there's everything from the failure from the CDC that you noted that goes back generations, and a failure of the Black community of people living with HIV that feeds into the social determinants of health and the racial disparities in criminal law reform, but also, touching on how HIV criminalization feeds into the system of mass incarceration. But at the same time, it's hard I think we rightly note that the wrong direction is focusing on health status in a criminal law reform or focusing on behavior. And part of what makes that difficult is that it's hard to come up with a single model bill because every state is different. Every state has a different legislature, a different political environment, court environment, different demographics, and the laws are just too varied from state to state. But that doesn't mean that HIV anti-criminalization work can't share some principles. So I think, Eric, I would just like you to maybe touch on what do you think are the most fundamental principles to guide HIV anti-criminalization work?
Just putting my legal hat on, one, the law needs really have an intent, a mens rea, like that's like number one. Number two is around proportionality. So, criminal law tells us that, punishment has to be proportionate to the harm that's caused. So if you are in a state like Georgia or Mississippi or Missouri, where it's a disclosure law, no transmission happens, and you're saying that this person should be in jail for 10 years and have a felony. And remember, a felony goes with you even once you've wrapped it up, even after you've served your time. So that's sort of the number one, are those two things. Number three, or number two, whatever number I'm on, the next one is really around the piece around felonies. We should be, creating legislation that, at minimum makes it a misdemeanor and not a felony. The third piece I would add is just really around, it has to be around the science. And so this piece around U equals U, I think becomes really critical in that. And that needs to be something that is at least an option around a defense for folks. And so building that into whatever legislation looks like as well. So I would say those are sort of the super important ones. And then just getting rid of the stuff around biting and spitting, these modes that we know have zero risk of transmission at all. Like we have to completely do away with that. And, I think, when we start having conversations with our partners in other movement spaces, because, this is really pertains to folks in law enforcement, corrections officers, and, other, folks in the law enforcement field, this is really a Blue Lives Matter sort of conversation. And so I think that if we start to have that sort of framework where we're able to really talk to the criminal justice reform folks about, well, this is actually the same stuff that y'all are fighting for. It just lands in a slightly different way. I think that we get a lot further in terms of having folks on board. And I think that as a movement, we've not done a good job of inviting other folks to the party who are not doing, HIV specific work. And so, yeah, those are the things that I think are super important to that.
What were you suggesting about a defense? What were you saying about it?
So right now, the only defense that a person living with HIV has is sort of, my word against yours. And so U equals U allows for you to go to a doctor and say, well, I had an undetectable viral load during, whatever period that this thing happened, and that becomes something that you can use as a defense in court, something that, under current law, really isn't really considered.
That's something that the PJP Coalition has discussed. I'm sorry.
Okay, go ahead.
I was just saying that's something that the HIV Justice Coalition has discussed explicitly, and we kind of have reached consensus to not go that route because we don't feel like anybody really deserves access to our medical records. We're trying to move out of, to protect, because our medical records are very vulnerable. Our health department is obligated to provide the prosecution with our medical records already.
Right.
Yeah,
So that's something that we've advocated.
I get that. I can understand that to a certain extent, but Eric, I think that you're completely right because of the simple fact that these when the person goes to trial, they can have these records subpoenaed no matter what. And if a prosecutor can subpoena my records for my downfall, why can't I provide my own medical records to show proof that I posed absolutely no risk to anyone here? So although I did not disclose, although we may have not used condoms, there was still a preventative measure in place, which was my responsibility to be on my medication and be having undetectable viral load. So I was at no risk to anyone. There was no harm done. There was nothing done.
And I think the goal is really about making sure that folks have options. And so right now, the options are, it's my word against yours. And I think that folks should have as many options available to them as possible. Again, putting on the legal hat, you are gonna fight for your client as vigorously as possible. And so you wanna have all the tools available possible to make that happen. And so, I think each state and each coalition will handle that differently, but I think the ultimate goal is around folks having as many options for protections as possible.
There's a question for me in the chat.
I think maybe let's turn to the questions at the end because I'd like Linda to connect to this dialogue too. We haven't really gotten to Linda yet. So is that okay, Devin? There'll be some time for questions at the end, everybody. But Linda, I thought that something that Eric said really, I think, could use, maybe I think you would like to address it as well, because he noted that Georgia, like Mississippi, is one of the states that criminalizes exposure to bodily fluids that are not known to carry any kind of scientific or known risk for the transmission of HIV. So how do bad science or pseudoscience in the law and systemic racism collide in states like Mississippi, like under the HIV criminal law?
In Mississippi, we have a law in the books that makes it a felony if you expose someone to HIV through urine, saliva, blood, feces, or semen. If you have HIV, hepatitis B or C, you can get up to 10 years in jail, 3 to 10 years. But if you don't, it's 1 to 3 years in Mississippi. So about 78 to 79% of new HIV diagnoses in Mississippi are Black people. And we make up 38% of the population in Mississippi. So when you look at the actual statute, it's hard to you can't even get past the science of you can't transmit HIV through certain bodily fluids. So that the statute, the science is wrong. It's not updated. It was based on, discriminatory practices and misconceptions, and it's never been fixed. And that's something we're working on. And the exposure, and Eric touched base on this, the exposure versus the intent. You're exposing them. You're not even transmitting. I'm sorry, exposure versus transmission. So the person doesn't even have to transmit HIV, and they can still get up to 10 years in jail, in prison, if they expose the person to HIV. So the penalties in itself is severely punitive. A felony, and it stays on your record, and the misdemeanor is up to 1 year. So that in itself it's troublesome. HIV criminalization itself, it discourages testing. It discourages disclosure. And those are real issues we really need to talk about. You know, some of the things we've been doing in Mississippi, and I can just touch base on, you know, we've had there's been a bill introduced on the House side for the past 4 years has never gotten out of committee. And just, you know, the will of the people that we want this changed versus what is a priority is an issue. And advocates in Mississippi have been working on this issue for years. We have AIDS Day at the Capitol. The Mississippi Positive Network is there with their folks. We educate legislators and policymakers, and not just when the session is in, but whenever there's an opportunity to do that. The Mississippi Center for Justice and Mississippi in Action, we're working on a project that's exploring the intersectionality of HIV criminalization and mass incarceration. And Eric gave some of those disparities in from a racial lens. We're planning an informative webinar in November, so we'll make sure everybody knows about that. But we've also met with law enforcement who invited us to actually train their leaders and staff on HIV transmission and criminalization. So stepping outside the normal scope, even engaging prosecutors and others about why these types of laws are not good, and even exploring defenses, which Eric already touched base on. So, you know, stigma fuels these discriminatory practices and laws. And again, it's so hard to get beyond the science that it's just not right. And then the disproportionate sentencing for a penalty for someone who has HIV, 10 years for exposure. So, you know, addressing the racism in the criminal justice system is definitely a racial and social justice issue. That's why this is a racial and social justice issue. So it's hard to ignore the intersection of HIV criminalization and mass incarceration. In Mississippi, Black people comprise 62% of total offenders in Mississippi correctional facilities. And again, we only make up 38% of the population. Nationally, 13% of the United States is Black, and 40% of the United States population that's incarcerated is Black. You know, that's a disproportionate burden on Black folks just from an incarceration standpoint. So the prevalence rate of HIV in the United States incarcerated and population is 4 times the rate of HIV than the general population. You know, COVID only magnified what Black people have experienced for many, many years. And again, you know, it comes back to racial inequities, health disparities, which manifest in poor outcomes for Black people. We already knew that the health disparities existed. And COVID has truly shine a spotlight on that, and I think now is a great opportunity to use that to help remedy a lot of the things that we know are not right. Decriminalizing HIV should not be an ancillary conversation when we're talking about public health. We you know, breaking out of our silos and bringing folks to the table who wouldn't normally be there, engaging, as I said, prosecutors, you know, our business community, of course, you know, public health sector, social workers, the justice system, youth courts, county courts, and others to make sure that people are educated on, we need everybody at the table. You know, I want to briefly talk about, even from a legislative standpoint, in talking to our policymakers, not just the folks at our state capitals, but even in local municipalities and towns and cities, to get them on board. You know, talk about stigma, talk about how, because this affects everyone. All the citizens at some point. You know, people living with HIV you don't want people to fear, again, getting tested and what that looks like. So identify legislative allies, and just, you know, engage your policymakers.
I think those are all excellent points. And I think there's a unique opportunity here too with, you know, legislative sessions are going to be opening pretty soon next year in most states. And I think we always want to start an advocacy campaign in a state with an aggressive and proactive education campaign with lawmakers and other stakeholders in the criminal legal system, but with lawmakers on the basics of sexual health literacy, on the roots and risks of HIV transmission. And I think U equals U definitely has to be a part of that education piece. But we also, just because it has to be a part of that education piece because it's basic sexual health literacy. And I just want to address something that Nema said in the chat. I think because of technical difficulties, we started a little late, so we're just going to be running a little late to make sure we fill the hour. I'm sorry if I'm sorry about the technical difficulties that may mean that some folks have to log off. I apologize for that. But I just want to make sure that we have some time for Q&A. You know, some of you, I think, have been writing some questions in the chat. And we can also, there's also a couple questions in the Q&A part as well. So looks like Justin Smith asked, can panelists talk about the specific legislative reform asks that have been successful in anti-criminalization efforts? Are there commonalities across jurisdictions? And I think Eric noted on what are some of really kind of the uniform principles that advocates in states are working on, right? That criminal law reform efforts should rest on intent to transmit, that transmission actually occurred, and that the conduct actually posed a scientific and known risk of HIV transmission. So you know, the statutes that criminalize exposure via bodily fluids that cannot transmit HIV, those go away. But because, you know, those are really some of the unifying principles that folks at the Positive Justice Project have found really useful. They're guiding principles that have been useful to state level advocates. I think that's what, you know, what illuminates the need for this conversation too, right? How do we incorporate sexual health literacy, U equals U, as part of an education piece, as part of a public health strategy of engaging policymakers and decision makers, but also making sure that that we don't create a viral divide in the law. There are states that have reformed their laws, I guess you could say successfully because the reform passed, but there are states like Michigan and North Carolina, and the code in North Carolina is not a criminal code, it's an administrative code, but in either case, they do afford an affirmative defense to prosecution if an individual is virally suppressed or used a prophylactic device. But I think as so many of the panelists noted, the disparities in treatment, you know, in access to treatment really highlight the extreme risks there of really only protecting in a criminal legal setting people who are virally suppressed, which is, I think, you know, why the work at the U equals U campaign doesn't just end with you know, U equals U, but also stressing the importance of advocating and pressing for universal access to care. But
and that's Amir.
Yeah, sorry, go ahead.
I just want to say that's exactly it. There's a song that there's a third you that's always there. The other you there is you, the person, and trying to influence and teach folks how to advocate on their own behalf to get to a virally suppressed status. And something that Linda touched on that I want to talk about really quickly is how criminalization is a deterrent. People don't want to get tested. If I get tested and I find my HIV status, then I'm held responsible to a certain degree, and I can be criminalized. That's what that feels. But what we have seen and what research has also shown is that because of U equals U and that education has also increased folks to want to get tested. It's removed the barriers and the stigma around folks wanting to get tested. because they know that if they get on effective treatment after receiving a positive diagnosis, what that looks like and what that can do for everyone, them, and those around them as well. And the science, like you said, Linda, and I've seen some folks in the comment section talk about the science the laws have to catch up with the science. If the science is changing, the laws should be changing. And as that changes and grows, why our laws are still stuck back in the 80s and 90s, I have no idea. But if the science is stating, as we keep saying, that people with undetectable viral loads cannot transmit this virus, those laws need to be updated around that in some way. No, treatment as prevention should not be the forefront of any criminalization reform at all, because it won't be fair. We know that. There's about 400,000 plus folks who are not in care, who are not receiving care right now. So they probably do not have a virally suppressed vote. We know that. However, it has to fit in there in somewhere, in some place, and it's going to be a mechanism that is going to be leveraged towards policymakers, period.
And I would just add to that, Deondre. I think that summed it up. Like we can stop right there. But I did want to just add, what a successful piece of legislation looks like. Ideally, we also want to make sure that we're not leaving out, folks who are engaged in sex work, because that's oftentimes a penalty enhancement in a lot of statutes across the country. And I know that there have been states where there have been updates to the law, and folks who are involved in sex work have been left out of some of those conversations. Also, people who use drugs and people who inject drugs, again, another space in which it's often written into the statute, and sometimes those communities of people who are folks who are left out of the conversation as well. And so ideally, any reform effort would also include reforming the law to make sure that those folks aren't left behind. And so I just wanted to make sure that, we had a little conversation about making sure that those folks are also not left out of the conversation.
I see Linda and Devin, you're both unmuted. Would you like to jump in? Or Linda?
I mean, I wouldn't have anything else to add. I mean, it really wrapped it up. The science and, what a good law would look like. I mean, that's a great start.
And Devin?
It's a strong start.
Yeah. So, go ahead.
Now, if the science doesn't comport with the law, that's an issue in itself. And as I said earlier, you can't even get past that without correcting the science part, because especially when it's scientifically wrong, inaccurate, and people are actually going to jail, to prison, and being prosecuted based on inaccurate science. It shouldn't be in the law. It shouldn't be in the law.
So in my state, we're targeting the mens rea. So right now, the mens rea in the state of Missouri is basically if you had sex while you were conscious. So we want to change the law to make sure it's recognizing intent. Did the person intend to cause harm? Regardless of what their viral load is, did they intend to cause harm? And that's what we need to include in the law that's puts people at risk for a felony. And again, our law criminalizes people even when HIV exposure, even when HIV transmission does not take place. So it's more important for us to add intent to the law. There was an earlier question about prevention, my comments on prevention. So those, I was referring to conversations that happened in Kansas City that were among primarily Black women, if that's a demographic that you may be interested in working with. Yeah.
No,
I feel
sure.
like UPSU is, I feel like UPSU represents very important public health benchmarks, but it's a little hazy for me when we're talking about like individual risk, because it would look like we're depending on trusting your partner.
Right. Devin, I would love to connect you and that group of women with Davina who's in the comment section. She's actually the one who asked the question. She's a Black woman who has been leading, the conversations among Black women as it relates to youth issue across this country. So I would definitely love to connect you guys that, that group of women can have those conversations with another Black woman who has trusted youth for years. So for sure, we can make that happen.
And I do want to challenge us around the use of risk and what's risky behavior and what's not risky behavior. And, I just want to push back on that, just a little bit, because, what may be considered a risky behavior for me may not necessarily be a risky behavior for someone else. And so just really trying our best to employ a model around harm reduction, as we think about all of this work and as we kind of move it forward, and, just kind of thinking about it that way, because I do think that we sometimes get locked into this thing of, especially when it relates to HIV stigma, around someone's behavior is the reason that they are, transmit HIV. And so really moving away from that thing of like, it was about someone's behavior, and it has more to do with, did this person have access to the things that they need to live the healthiest life possible? And so.
Great, and actually, Eric, you earlier touched on something that I see Davina in the comments raised, but before we close, that the science of U equals U was useful in a direct case assistance with, for example, Sanjay Johnson and countless others. And I think you were touching earlier on the importance of, people like defense attorneys and public defenders. Their obligation is to get their client free. And this is, if you visit, the HIV TasP consensus statement, and you take a look, that's something that basically all of these stakeholders and organizations agreed on, that on an individual case assistance level, these are, your attorney is obligated to use everything that they can do to get you free. And the experts who worked on the consensus statement made that clear, that's fair game. But I think as a final remark, and thank you, for really lively conversation, everybody. I really enjoyed it. And, I think as a final remark, I'd like to just, summarize a lot of what some of the final remarks of Eric and Linda, that about like breaking out of our silos, right? If we want to focus on, as we approach 2021, and we want to focus on cross-movement organizing and breaking out of our silos, strengthening relationships with sex workers and sex worker rights organizations, racial justice organizations, with harm reduction and engaging people who inject drugs in this fight to decriminalize HIV. I think the whole spirit of the HIV consensus statement, the HIV TasP consensus statement, is that we just not reproduce or reinforce harmful discrimination against people living with HIV in the criminal law by enshrining into law a defense for people living with HIV who have achieved viral suppression, but leave folks behind. And I think the final remark is let's make sure that modernization works for all. We leave no key group behind. You can visit HIV TasP Crim Law, that's TASP crimlaw.org, to learn more about the consensus statement on HIV treatment as prevention in criminal law reform. And once again, thank you to this wonderful panel. Thank you all for taking a little time to listen and hopefully learn a little bit about ways that we can make sure that we do not reinforce legacies of anti-Black racism in this anti-criminalization work. So thank you, everybody.